Good morning, everyone. Before we begin, I do want to take a moment of silence to remember the 2,977 people who lost their lives in the terrorist attacks on 9/11 24 years ago today. I remember that day very, very vividly. I was actually traveling down to Richmond when I got the news and then went back up to support my family. We remember each and every one of those victims, and we strive to make the world a better place and a safer place in their memory. Let's have a moment of silence. Thank you, everybody. Thank you for joining us for the joint meeting of the Emergency Committee on the Impact of Federal Workforce and Funding Reductions and the House Appropriations Committee. You could not come up with a longer name than that. I want to thank the Speaker, first and foremost, for his leadership in establishing this committee and entrusting us to conduct this very, very important work. We have learned a lot over the last several months, and we are excited and looking forward to presenting our report to you. Chair Torian, I want to thank you for your leadership and for lending us your incredible staff. They have done an absolutely amazing job, both logistically as well as researching and synthesizing just an enormous amount of data. Thank you all. I also appreciate that our policy committee chairs have joined us here today. The federal budget realignment process will not just affect our state budget, but it will impact a wide range of policy areas, and I thank each and every one of you for being here with us today. When the Speaker convened the Emergency Committee, he gave us three main tasks. First, collecting data on the potential scope of workforce and funding cuts. Second, analyzing the likely impacts of those cuts on Virginia's economy and budget, should they be partially or fully realized. And then third, and probably most importantly, inviting stakeholders across a wide range of interests to provide their perspectives and to share potential ways to mitigate the impacts on Virginians. I also know that it was very important for the Speaker that we recognize that this isn't just a challenge for a few communities, but a challenge for all of Virginia. That's why this bipartisan committee took the show on the road, traveling from Alexandria to Wytheville to Norfolk and then back to Richmond. And during that time, we logged hundreds of hours listening, learning, and working together. Throughout that process, we received literally hundreds of comments from Virginians and stakeholder groups representing a wide variety of perspectives. These comments are reflected in our report. We also received formal letters with thoughtful recommendations from a number of organizations. These letters are included in Appendix A of the report. I want to acknowledge that one of the greatest challenges that we faced as a committee was conducting our work in real time as debate and the scope of the cuts at the federal level were unfolded. And while there still remains some uncertainty today with the recent passage of the reconciliation bill, the impacts on Virginians and the choices that we will have to make as elected officials have come into much clearer focus. In our report today, we will highlight the following: key known impacts facing Virginians and the General Assembly, areas where there is still uncertainty, and recommendations regarding the data that we need to make smart choices going into the next legislative session. This includes data requests and analysis from the Department of Medical Assistance Services, the Department of Social Services, the Department of Taxation, and our colleges and our universities. And finally, we have identified potential actions for consideration by the General Assembly. These include items identified by stakeholders in the area of housing, unemployment insurance, workforce development, and targeted investments in economic development to diversify and strengthen our economy. Before handing over our presentation to staff, I do want to highlight just a couple of final points. First, the committee was established with a mission to be bipartisan and data-driven. I am proud of the committee for its work in accomplishing both of these missions. Second, while the impacts of the reconciliation bill involves one-time costs, many of the items will require a long-term commitment of resources. While our current unappropriated balance provides some flexibility to deal with one-time costs, it is not prudent to use one-time funds for ongoing obligations. This will be a challenge, and prioritization will be key. And finally, it is important to recognize that we are not operating in a vacuum and that there are other needs that we must consider over the upcoming biennium. This includes mandatory increases in spending for existing K-12 programs as well as Medicaid. Early estimates indicate that these two programs could require an additional $1.75 billion in state funding. At this point, I'm going to ask Mr. Reynolds to get the presentation kicked off. I would ask that we allow for all of our staff members to be able to present their reports, and then we're happy to take questions and answers at the end of the presentation. Mr. Reynolds, the floor is yours.
All right. Thank you, Mr. Chairman. Good morning, members of the Emergency Committee, Appropriations Committee, and the various House committee chairs. This morning, we'll be providing an overview of the Emergency Committee's work and its findings so far. First, I'll hit briefly on a summary of the Emergency Committee and its work. As Delegate Bulova mentioned, the Emergency Committee is a bipartisan group established by the Speaker this past February in order to monitor changes in federal spending as well as the federal workforce, with additional direction to get input from stakeholders and the general public on how to begin addressing issues arising from these changes going forward. The Emergency Committee has held 5 public hearings across the Commonwealth this year in order to hear from stakeholders and what they're seeing and hearing in their areas, as well as getting their ideas of how to best respond. As you can see on this slide, this has included receiving dozens of presentations across a broad array of topic areas. And as Delegate Bulova mentioned, receiving just lots of public comment in a variety of areas throughout the process. This has been necessary work because it's hard to overstate how important federal spending is to Virginia. In Virginia, approximately 24% of total economic activity in the state is in some way reliant on federal spending. This is because the federal government is a major employer within the Commonwealth, is a major consumer of goods and services, and is a major investor in services, programs, and infrastructure throughout the state. The federal government is the largest direct civilian employer within the Commonwealth, representing 10% of Virginia's overall civilian employment. In total, the federal government employs 321,000 full-time and 26,000 part-time civilians within the Commonwealth, meaning Virginia has more federal employees than any state but California. The federal government also spends more than $100 billion per year in Virginia as a consumer of goods and services. To give you a sense of scale, this represents 1 of every 7 federal contracting dollars spent in a given year. According to Weldon Cooper, this spending supports more than 441,000 private sector jobs across the Commonwealth, and the majority of those jobs are in higher paying fields in the professional, scientific, and technical services industry. Federal spending also supports a number of services provided to Virginians through the state budget. Approximately 1/3 of the state's budget is supported by federal funds, or about $24 billion in the most recent completed fiscal year. More than 90% of this spending is focused in 5 program areas, with the Medicaid program in particular receiving more than $14 billion. In addition to funding state government services, the federal government also supports a number of programs at the local level. In total, the $4.4 billion in federal spending flowing through to local governments supports an estimated 35,000 jobs across the Commonwealth. The federal government also provides direct payments to Virginia residents through a number of programs, including Social Security, Veterans Benefits, and the SNAP program. Many Virginians rely on these resources to support their basic cost of living, including housing, food, and utilities. And in many communities, these benefits are an important source of spending within the local economy. So what does this all mean? Federal government spending is inextricably linked to Virginia's economy, meaning that reductions to federal spending or employment levels within the state can ripple through Virginia's economy quickly, leading to job losses, shrinking tax revenue, and strains on core services that state and local budgets can't easily absorb. Shifting gears a bit, this next series of slides is going to lay out what we know with certainty at this point, as well as what areas are still uncertain, and what decision points will likely face you all in the year ahead. The committee has seen this year that there are a number of processes and procedures available to federal policymakers to change federal spending and employment. Over the past 8 months, we've seen changes flowing through all of these areas, from executive orders to changes in regulation and guidance, as well as the Congressional Appropriations Precision and Reconciliation process. So in order to focus today's discussion a bit, we'll start with the most concrete federal action so far, which was the Reconciliation Bill, or H.R. 1. The bill itself contained hundreds of provisions making changes in the ways listed here. I'd say an overall theme that we've seen with this bill has been that tax cuts have immediate effect and are pulled forward, while the spending cuts and programmatic changes are delayed somewhat and will roll out over several years. While the reconciliation bill is the most concrete example of federal changes this year, we're still operating with a little bit of uncertainty until federal agencies begin to issue the regulations and guidance. That said, we believe there are 5 key areas of the reconciliation bill that will have the most substantial impacts on state budget and policy going forward. These are in the areas of SNAP, Medicaid, the premium tax credit, higher education access and affordability, as well as federal tax policy. At this point, I will pass the dais to my colleague, Amy Cochran, who will walk you all through the Reconciliation Act changes to the SNAP program.
Good morning. So turning to the impacts of H.R. 1 on the SNAP program. First, there's a new state matching requirement for the SNAP benefit allotments. And this state match will range from 0 to 15%, depending on the state's SNAP quality control payment error rate. Based on Virginia's error rate of 11.5% currently, we will have a match rate of 15%, costing $270 million per year. And this will start October 1st, 2027. If a state's error rate is below 6%, there's no matching requirement. However, our average error rate for the past several years has been around 9.5%. Even if we're able to get our error rate below 10%, that will still cost the state $180 million. H.R. 1 also implements a new administrative cost-sharing model between the state and the federal government. Currently, it's 50% non-general fund and 50% general fund to operate SNAP. H.R. 1 shifts this to 25% non-general fund, 75% general. So starting October 1st, 2026, we will have to pay an additional $90 million in administrative cost. I will note that this is not based on our error rate in any sense, so we will have to pay this no matter what. H.R. 1 also makes a variety of changes to work requirements in order to receive SNAP benefits. The age range is extended from 18 to 64 years old for both general work requirements, as well as the work requirements for able-bodied adults without dependents. It also changes the definition of a dependent children to kids under 14 instead of 18. It also removes some of the work exceptions for homeless individuals, veterans, and those 24 and younger who have aged out of foster care. This will impact the workload for local departments of social services who determine the eligibility, and more than likely, they'll require more staffing and IT upgrades, but the costs are unknown at this time. SNAP eligibility is now limited to citizens and individuals lawfully admitted for permanent residence, such as refugees and individuals granted asylum. Lastly, H.R. 1 also limits future reevaluations from increasing the cost of the Thrifty Food Plan. This is a model developed by the USDA to determine the cost of groceries for a family of 4, and it's used to determine the SNAP maximum monthly benefit amounts. So this will impact the amount of SNAP benefits an individual receives, especially taking into account the increasing food cost. With that, I'll turn it over to Susan Massart.
Good morning. I will go over the impacts on the Medicaid program. To start off with, these are the largest policy changes that you're going to see in this program, although there's a bunch of small ones I'm not going to go through today. But first of all, for the Medicaid expansion population, effective January 1, 2027, eligibility redeterminations will be required every 6 months for that population. There will be impacts on enrollment in the program at both the Department of Medical Assistance Services and the Department of Social Services, which does the eligibility for the Medicaid program. Right now, the costs are unknown, but I will say that the costs would be borne by the non-general fund component that's made up of the hospital assessment and federal matching dollars. The second one, again, affects the expansion population, and it requires them to participate in work requirements. It could be work, community service, or education. It has to be at least 80 hours per month, roughly 20 hours per week. That would take effect the first day after December 31, 2026, or possibly 2 years later if a waiver is granted by the Centers for Medicare and Medicaid. Again, an impact on enrollment, impact at DMAS and DSS. Again, we don't know the exact cost of that, but it will not affect the general fund component of the funding. And then finally, there's a requirement for co-payments for Medicaid expansion enrollees with those with incomes over 100% of the federal poverty level. That takes effect October 1, 2028. Impact right now is unknown. Those co-payments could be anywhere from $1 to $35 max on various services that Medicaid recipients receive that are in the expansion population. And that will be somewhat discretionary at the discretion of the Department of Medical Assistance Services. So right now, it's likely that you will need action during the 2026 session to implement the redeterminations of the Medicaid expansion population and to prepare for the implementation of the work requirement policies. Virginia will have to request a waiver if we don't believe we can implement that within the time frame required by law. However, we won't know when or if that waiver will be granted, so we will have to prepare regardless. Again, there's no estimates on the enrollment impacts. There's a variety of estimates out there from folks that are federal contractors that specialize in Medicaid, Urban Institute, that kind of thing, but it's a wide range right now, so we really don't know whether this will impact the number of people that drop off the rolls or those that stay on the rolls. We would expect to see some budget submissions from both DMAS and DSS this fall, addressing technology changes and any staffing requirements that they're going to need to implement these provisions. Going to the next slide, H.R. 1 also impacts Medicaid hospital payments. Currently, there's 63 private acute care hospitals that are taxed at 6% of net patient revenue in Virginia. That's used to fund the Medicaid expansion program. Virginia's share of that, what would be the state share otherwise? It's about $650 million per year, or 2% of the total tax that funds the expansion component of the program. But it also, the provider tax provides higher Medicaid reimbursement for hospital services, and that's about $1 billion a year, and that takes up about 4% of the tax. In terms of the policy changes, effective October 1, 2027 through September 30th, 2032, The bill requires a reduction in this tax of 0.5% per year until it reaches 3.5%. So that the amount that can be taxed on the hospitals will be coming down. So their revenue, the revenue that they get from the federal share, will be reduced. It will not impact our ability to operate a Medicaid expansion because that only takes up about 2% of the tax right now. What it will impact is the revenue that the hospitals get from their enhanced payments for Medicaid services. There's also no limits on there's no new provider taxes that can be imposed for hospitals at this point, and any other. There will also be a reduction in hospital payments that are above 100% of the Medicare rate. As you might remember, for some of you that have been on the committee, when we went into expansion, at the time, the hospitals were getting about 78 cents on the dollar for their hospital payments through Medicaid. This was an ability to grant them to use a provider tax and pull down the additional federal funds. That was a way for them to get additional payments that would get them closer to their actual cost to deliver the services. Medicare also does not pay 100% of hospital costs. I've seen different figures. The latest one I saw was Medicare pays about 83 cents on the dollar. So if this brings it down to 100%, you can imagine that will bring down the hospital's ability to cover 100% of their costs. Next slide. I want to just talk real quickly about the premium tax credit for health insurance for those that are on the that buy their insurance through the health insurance exchange or the health, what's called now the health insurance marketplace. You might recall that the Affordable Care Act back in 2014 established advanced premium tax credits for purchasers of the individual insurance through the exchange, so their premiums wouldn't exceed a certain percentage of their income. And how they function is a subsidy, a credit that's paid in advance of actually claiming the credit. It's a subsidy that gets paid directly to the health insurers to offset their premium amounts. And they were made available to individuals that were buying insurance with incomes from 100% to 400% of the Federal Poverty Act, or poverty level. The American Rescue Plan Act, or ARPA, then expanded those premium tax credits to people with incomes greater than 400% that were buying their insurance on the exchange. And they also lowered that premium contribution as a percentage of household income to all of those individuals, anybody that bought health insurance on the exchange. And what that did was it lowered the contribution for the lowest level, like 100 to 150%, to 0%. And those were originally set to expire on January 1, 2023. The Inflation Reduction Act came along and extended those tax credits through December 31, 2025, unless renewed by Congress. So they expire this December unless renewed by Congress. H.R. 1 did not address this issue. They did not extend any premium tax credits. There still would be an opportunity for Congress to act between now and December if it so chooses to do so. But the loss of that advanced or the extended tax credits will lead to higher monthly premiums. Those insurance premiums were published, I think, on the SCC website in August, and they will be increasing. Right now, there's an estimate of about $250 million that would be needed for Virginia to assume responsibility for providing an identical tax credit to families above and below, or above 0 to 400% or above. To those individuals that buy insurance on the marketplace. Obviously, the timing is not good because the open enrollment for those policies begins in November, and they will close before you come into session. And I'll turn it over now to my colleague, Tony Maggio.
So HR1 may have an impact on access and affordability. It's going to be based on some of the Pell eligibility changes, the student loan changes, and some of these new accountability measures. That's going to vary by institution because there are differences in the student population and the programs. It's important to note that there were several key provisions that were of concern early that were not in the final bill, mainly the definition of what a full-time student was, the elimination of the subsidized student loan program for undergraduates, and then using national cost medians as opposed to institutional specific cost data. First, in the area of the Pell eligibility, so it does exclude students with a student affordability index or aid index that is twice the maximum Pell amount. That's around $14,000. Now, looking at some tables that show kind of a crosswalk from the family income to the student aid index, that would start to impact students with family incomes of around $95,000 with one dependent up to $125,000 with a family of 4 dependents. Now, under previous Pell methodology with the EFC and even with the new SAI, Pell awards really began to drop off at between $70,000 and $80,000. Right now, 76% of all Pell awards go to low-income students. That's 0 to 200% of the federal poverty, and the rest goes to middle income, so from about 200 to 400%. So the eligibility issue may have some impact, but right now it's still something that we need to take a closer look at. There was an expansion for workforce programs. That also is something to be determined, trying to figure out which workforce programs might be eligible and how that would impact some of the students and the institutions. As far as student loan programs go, there's no change in terms of student loan caps for undergraduate students. There is a cap on the Parent Plus loan of $20,000 annually and $65,000 in aggregate for a dependent student. For graduate students, there is a loan cap of about $21,000 annually and $100,000 on a cap. And for the first professional students, there's a $50,000 cap annually and $200,000 aggregate. The real key here, though, is that it ends the Grad Plus program. Grad Plus programs, since FY20, borrowing in general has dropped. That's mainly due to the investments that you've made in higher education over that time, because the cost of attending has actually dropped relative to the rate of inflation. So borrowing for undergraduates has dropped from 56% to 50%. But the real impact will likely be on graduate and the first professional students. The Grad Plus program accounts for over 25% of overall grad and professional borrowing, and that's for in-state students. And there is about 2,200 students that might be impacted by that. Lastly, on the accountability measures, I keep wanting to click. I'm sorry about that. On the accountability measures, it does create a low earnings income accountability measure that will be looked at for academic programs that fail to meet that measure for 2 out of 3 years. Those programs could lose direct loan eligibility. Chev's estimate is that there are about 39% of the associate programs are at risk, and about 16% of bachelor's programs are at risk from that measure. And I will turn it over to Michael.
Good morning, Mr. Chairman. On tax policy, wait a second, this is the first one you'd already switch over. Virginia has historically been a fixed date conformity state. As you know, what that means is each year legislative action has to occur in order to conform to any changes in federal tax policy. In 2023, the legislature, we became a rolling conformity state, which means that much of the tax policy changes on the federal level will automatically apply to Virginia as long as it's a policy that changes the federal adjusted gross income. However, in last year's budget, There was a pause put on rolling conformity for 2 years, calendar year 25 and 26, due to the expectation that there would be significant changes on the federal level, and the intention was to make sure the General Assembly had approval before any of those changes came into being in Virginia. The Department of Tax is working, last time we have talked to them, they're working on all of the provisions of tax policy changes that were passed in H.R. 1. They have not released anything. This is obviously very detailed, and there are, to our knowledge, no state-specific estimates for Virginia for any of the legislation provisions related to tax policy yet. There are three major sort of categories that could be identified in the tax policy changes that were in H.R. 1. The first one is, and the largest one dollar-wise, is the extension of existing tax policy. Many of the TCJA provisions were set to expire at the end of 2025, and there was part of the legislation was to extend these provisions. The largest ones are the larger standard deduction, more generous child tax credit, lower tax rates, as well as a couple other smaller ones. And these will automatically come into being in Virginia because they are just basically extensions as opposed to new tax policy. The other two categories of tax policy that was adopted in H.R. 1 is adjustments that basically change the federal adjusted gross income. These are considered above the line changes, the largest ones being a change in the SALT cap, as well as a more generous child tax credit and itemizing charitable deductions on top of taking the standard deduction. The third category is below the line deductions. These items are deducted after the federal AGI is calculated, and in any case, either one of these two would need legislative approval before they would become law. The ones that are included in the third category include the taxes on, excluding taxes on overtime, deducting car loan interest, and not taxing tips. Either one of these, again, would require legislative action before they would become effective for Virginia tax policy. Next, I will move on to Andrea Peaks.
Good morning. As you've heard and will hear throughout this presentation, the federal government plays a particularly significant role in creating and supporting jobs in Virginia, not just as an employer, but because Virginia also ranks #1 among states in total federal contract spending per capita, spending that, of course, translates into goods and services that create Virginian jobs. Throughout its meetings, the Emergency Committee heard a consensus from multiple speakers that a clear picture of the impact of Virginia's employment numbers won't be available until later this fall. That includes the impacts from the federal government's deferred resignation program that takes effect at the end of this month. Litigation challenging the legality of mass federal employee layoffs continues, but a July Supreme Court ruling allowed these layoffs to continue amid these challenges, resulting in layoffs that continue to impact a wide range of federal agencies. As such, while it's still too soon to know specifics both on the totality of the federal government's layoff plans and their ensuing impact on Virginia's employment numbers, we do have some initial reads that I'll walk through in the following slides. First up, in looking at the yellow line, we see that while Virginia's unemployment rate remains below the national average, it has been consistently rising since January, from 3% in January to 3.6% in July, the latest data available. Since the national average has been relatively flat during the same period, it emphasizes the more direct impact of recent federal actions on Virginia specifically. Also of note on the chart is the similar progression of Maryland's unemployment rate, shown in the blue line that tracks most closest to Virginia's yellow line. Like us, our neighbor to the north also relies on the federal government to employ people and to purchase goods and services from the federal government, so we see the recent upward trend in their unemployment rate as well. Secondly, an early data point, for another one for your consideration, is the month-to-month employment data from the Bureau of Labor Statistics Current Employment Survey. On this chart, you're starting to see job losses in the federal sector within Virginia, with just over 9,500 jobs lost between January and July of this year. On a month-to-month basis, we do see that Virginia had an increase of approximately 1,400 federal jobs between June and July. That deviates from the overall trend, so we'll have to keep a close eye on future reports to see if that was an anomaly, especially once data is available after this month's resignation deadline. In comparison, we can see employment at the state has remained relatively flat, even showing some recent growth. We thank the Secretary of Commerce and his team who've been tracking the number of federal workers in Virginia claiming unemployment insurance and for their responsiveness to our request for information. As of August 30th, less than 2 weeks ago, just over 1,600 federal workers have filed for unemployment insurance in the state. Again, a number that is likely to rise once the resignation deadline takes effect this month. Of largest threat to Virginians, according to the Weldon Cooper Center, who, like many others, have provided some initial estimates on the totality of current and future layoffs by the federal government, is from the Department of Defense and of Veterans Affairs. While these estimates are based on public announcement data and thus subject to change, Weldon Cooper estimates a nationwide total of over 170,000 federal government layoffs to date and another 162,000 jobs planned for elimination. For Virginia specifically, the numbers show approximately 11,000 federal jobs already impacted with another 10,500 jobs at risk. The largest shredding of jobs is expected, as I said, at the Department of Defense, where an estimated 1,000 Virginia workers have already been impacted and another 5,700 may follow. As we know, Virginia relies on federal government contracts with private sector companies, particularly those held by the DoD and the VA. As such, additional job losses in the private sector are anticipated as a follow-through impact. As of August 30th, 2,600 Virginians have filed for unemployment insurance from the top 100 federal contractors in the state, representing jobs in the professional, scientific, and technical services industry. Up next, Zach will walk you through additional federal reduction impacts on Virginia.
Well, good morning. So federal grant cancellations, rescissions, and eliminations have created significant uncertainty, and we don't yet know the full scope or scale of the impact of these actions to the Commonwealth. Information we have been able to gather has been directly from the impacted entities like localities, nonprofits, and others. The Secretary of Finance is tracking these funding actions as they impact state agencies. At the Joint Money Committee meeting in August, he stated that about $420 million in these grants have been paused, about $300 million of which were COVID-19 related grants. Also in June, the chairs of the money committees sent a joint letter to the administration requesting details about these canceled funds, but this request we've not yet received a response to. These next two slides provide examples of cancellations, rescissions, and eliminations, and demonstrate how they've impacted projects and organizations across the state. This is not an exhaustive list. First, the Building Resilient Infrastructure Communities program was canceled. That was intended to support states and localities with mitigating human and economic harm from natural disasters. Some projects in Richmond and Portsmouth were eliminated. One project in Hampton lost funding from the elimination of the Environmental and Climate Justice Community Changes Grant Program that was aimed to help communities reduce pollution and to advance climate resilience. The Port Infrastructure Development Program helps support development of offshore wind energy infrastructure. About $60 million in already awarded grants for projects in Portsmouth and Norfolk were canceled. And earlier this year, the National Endowment for the Humanities terminated their annual operating grant to Virginia Humanities. This represented about 20% of that organization's operating budget. And in response, we've learned that the organization has laid off 25% of their staff and vacated their office space. We also learned at our Norfolk meeting about programs aimed at addressing teacher workforce shortages at high-need schools. The Supporting Effective Educator Development, or SEED program, and TQP, Teacher Quality Partnerships programs, those have been canceled. This eliminated about $15 million that have been awarded to VCU and a consortium led by Alawite County in partnership with Norfolk State University that supports several school divisions across the state. So turning to the next federal fiscal year, which starts in about 20 days on October 1st. Congress is in the midst of developing the federal budget for federal fiscal year 26. The House has advanced all of its bills, with some having already passed on the House floor. And in the Senate, Four of the 12 appropriation bills have not yet been marked up, but that number is about to go down to 3. Currently, right now, Senate Appropriations Committee is holding a markup. Of the portions of the appropriations bills that have advanced through Congress, both the House and the Senate have rejected many of the administration's proposals, like elimination of Community Development Block Grant Program or elimination of the 21st Century Community Learning Centers after-school programs for at-risk youth. So looking at K-12, over the last few months, the area of K-12 has provided some good examples of the uncertainty within this federal fiscal environment, as public education has been impacted by these pauses, rescissions, as well as different ideas in Congress on how to fund FY26. So on June 30th, the U.S. Department of Education informed states that it would not release $6.8 billion in already appropriated funds to allow time for the administration to review these funding programs for alignment with the president's priorities. School divisions anticipated that those funds would be distributed as required by law on July 1st, so they received less than a day's notice that those funds would not be coming through. In Virginia, about $123 million was withheld, and that represents about 14% of Virginia's federal formula grants for K-12. And after a month following pressure and also following some pressure from Congress, the administration released all of the funds that had been withheld. So now that the FY25 funds have been released, attention in the K-12 space is shifting to Congress's budget proposals for the upcoming fiscal year, and the House and Senate proposals are quite divergent. The House proposes cutting K-12 funding by about $9.9 billion. It's about a quarter. Included within those cuts are about a third of Title I funding, as well as elimination of several programs, most notably English as a second language funding, adult education and literacy funding, as well as support for students experiencing homelessness. The House proposal also rescinds about $2.6 billion from already appropriated FY25 funds. The Senate proposal is kinder. It maintains the same level of federal support as is currently in place, and it does not eliminate any programs. It also includes a provision to prevent the administration from pausing the release of funds, as was done this past July. So as you can see, the gap between the House and the Senate is quite large and will need to be closed in order to adopt the budget by October 1st. So now Kim will talk to us about economic indicators.
As Andrea talked about earlier, Virginia's unemployment rate has steadily been rising since the beginning of the year. The latest quarterly economic forecast from the Weldon Cooper Center for Public Service predicts unemployment in the state will rise to 4.2% by the end of this year. Additionally, August job numbers for the nation were released last week, and you're seeing slower job growth with 22,000 jobs created on a month-to-month basis compared to an anticipated 7,500 jobs. State-level numbers for August will not be released until later this month, but the July numbers we do have indicate slow state employment growth, with only 600 jobs added to Virginia's economy from June to July of this year, placing the state 31st on this comparative metric. During the same time period, Virginia lost jobs in the professional, scientific, and technical services sector, which accounts for a large share of federal contract spending, and then durable goods manufacturing. I'm going to talk a little bit about the state's U6 unemployment rate, and that has risen compared to the same time period last year. This unemployment rate is a broader measure of unemployment and includes discouraged workers. So those are people who want a job but stopped looking, and individuals holding a part-time job who want a full-time job but can't for economic reasons. So Virginia's current U6 unemployment rate is 7.2%, which is 1.6 percentage points higher than this measure from the same time period last year. We still have a lot to learn about the potential implications of the reconciliation bill, but we know more than we did in early July when the bill became law. There are decisions still to be made by the federal government with respect to reduced spending and layoffs. And we're still not clear on the broader economic implications of the choices already made on Virginia's economic health and state revenue collections. We do know with certainty that the federal government realignment process is going to take place over the next several months, if not years, with Congress already talking about additional reconciliation bills. The state's reaction to decisions made by the federal government are going to be experienced over the next several budget cycles. This allows you, the General Assembly, multiple opportunities to plan, identify, and prioritize areas for continued state support. This is a long-term problem with implications we may not have thought of yet. Caution is going to be key heading into the next biennium with rising unemployment and slowing employment growth. Our revenue forecast may show available funding, but will that growth be in sources that provide ongoing stability, or will it be in volatile sources and fluctuate based on economic conditions? We still don't know that yet, and that process starts in early October. Just like caution is going to be key, prioritization will be equally as important. State and local budgets only have but so much elasticity to backfill declining federal revenues. This is going to be hard if economic conditions worsen, resulting in declining revenues and a heightened demand for core government services. While we still don't know what we don't know, we know more than we did when we started this process in February. And through the work of the Emergency Committee, we have surfaced some ideas that the General Assembly can consider during its next legislative session. So it should be clear by now, we need better data to help you all make informed decisions related to funding priorities and implementing the changes to programs like SNAP and Medicaid. But before we get into some of these potential policy actions, there is an information gap on the federal grants under threat to state agencies, local governments, and nonprofit organizations. You could respond to this need to direct the Department of Planning and Budget to collect and share information on federal grants eliminated to each of these groups. We don't know where the state may be able to help if you don't have the information. You could also ask VEDP to update its economic data book to track comparative economic information from the beginning of the federal budget realignment process. This resource would allow the state to easily track economic conditions related to job growth and unemployment. We, as Appropriations Committee staff, will continue to monitor the federal fiscal year 2026 appropriations process and identify potential challenges for the state budget as they emerge. The General Assembly needs more information from DMAS and DSS related to the cost associated with the major changes included in the reconciliation bill. Before the 2026 General Assembly session, this information could be requested by formal letter from the appropriate committee chair. We've already talked a little bit about the need to better understand the impact of the new redetermination policy, work requirements, and co-pays on Medicaid enrollment and overall cost, as well as the impact to the hospitals on changes to the provider tax. Better estimates across the board will lead to better financial planning for this and future biennia. We need to understand with more authority why Virginia's SNAP error rate is so high. If we can understand the problem or problems, you can create solutions to address and remedy the problem. The IT-related costs for implementing Medicaid and SNAP redeterminations and new Medicaid work requirements are particularly concerning for me. Our system was built in the early 2000s and processed not just Medicaid applications and SNAP applications, but all public assistance applications, including those for the Early Childhood Care Program. IT costs to states that have implemented Medicaid work requirements have ranged from anywhere from $5 million to $221 million. With such a large potential spread, it would be good to know where Virginia may land in terms of need. We need better information from every public college and university on the real impacts on the real impacts of higher education changes on students. As Tony mentioned in his slide, students in Virginia borrowed $55 million from the Grad Plus program in 2024. That is real money that will have to be found either by students, institutions, or the state to help offset the elimination of this student loan program. The General Assembly may want to require every institution to report on the enrollment and revenue impacts of changes to the Pell Grant program, caps on student loans, and elimination of the Grad Plus and Parent Plus program, and come up with ideas to remedy the potential shortfall so the entire burden is not placed on the student. So next, moving on, there are some potential near-term actions that the General Assembly may want to consider for helping federal workers, unemployed workers, and supporting the state's overall economic health. The Emergency Committee talked about adding a provision to the Virginia Landlord-Tenant Act that would allow laid-off workers to end leases early. You may want to consider this as a bill for a future legislative session. You could limit the duration of the policy, since the hope is that layoffs will stabilize eventually, and as a fiscal analyst, I have to point out the bill will not require a budget amendment. There are also ideas out there to provide additional support for the Virginia Eviction Reduction Program and to create a rental mortgage assistance program to support impacted federal workers. The Virginia Eviction Reduction Program has been in operation in the state since 2020 and currently receives about $3.5 million in general fund assistance that gets dispersed to regional nonprofits to help people avoid evictions. Additional money for the program can easily be tailored to one-time assistance targeted to federal workers in the Hampton Roads and Northern Virginia regions. There's also rental and mortgage assistance options the General Assembly could consider, and a state program to help support federal workers could be tailored after the COVID-19 programs. To help unemployed workers in the state, the General Assembly could temporarily increase the duration of its UI benefits to 26 weeks and increase the maximum benefit level. North Carolina temporarily increased its maximum UI benefit level to $600 during Hurricane Helene recovery. Additionally, benefits would be paid from the state's UI Trust Fund, which currently has about $1.5 billion in assets and a solvency rate of 57%. I will remind members that for UI-related claims from federal workers, that the federal government reimburses the state for those costs, and that these employees would not impact trust fund resources. The General Assembly could also consider a program to provide a reemployment bonus to all Virginia residents who receive UI benefits and accept and retain a job here in Virginia. The cost of the program would depend on factors like eligibility and bonus value. But some back-of-the-envelope math suggests about $100 million for a $1,000 bonus. However, this is the type of program that could be capitalized with one-time funding and distributed on a first-come, first-served basis. Skipped ahead. In terms of helping federal and unemployed workers transition to new jobs, the Emergency Committee learned about the Nova Next program to help provide short-term training opportunities to federal workers, which could be expanded statewide. George Mason University has recently launched Mason Career Academy to provide short-term training and credentials to its students and the broader community through a contract with Coursera. The General Assembly could, for a nominal value, under $1 million, cover the cost of this contract and make this training available to former federal workers. Training options through Mason Career Academy includes things like cybersecurity, data analytics, program development, and digital marketing. You could also look at a hiring incentive for companies to employ former federal workers through tax credits and incentives. This could be modeled after the Virginia Values Veterans Program, which provides a $1,000 hiring incentive to companies that hire veterans. Again, this program lends itself to a one-time grant program that concludes when funding is exhausted. In terms of economic resilience, you could consider a new program to help localities in Northern Virginia rehabilitate underutilized office space. And I will say that investments in areas like K-12 education, housing, and childcare are foundational in terms of making Virginia an attractive place to locate a business. I will remind members that over $1 billion in new money has been included for K through 12 and early childhood care activities during the 2024 and 2025 sessions alone. Safeguarding these investments is critical, particularly when resources are limited. So we don't know how much money we'll have for the upcoming biennium. The revenue forecasting process, as I said earlier, occurs primarily in the fall, and that will kick off in October. Everything remains on track in terms of revenue collections. However, some of those early warning signs we talked about earlier indicate caution in overcommitting resources too soon. Prioritization is going to be key. SNAP-related spending is not optional given the cost share and new matching requirements. That will cost an estimated $360 million in the state's next biennial budget. There will be choices to be made on whether or not to continue federal programs, like the Enhanced Premium Tax Credit, which carries a potential cost of $250 million. You can anticipate requests coming from localities and nonprofits to backfill lost federal funding. And again, we don't know what the scale of this need is. And many of the ideas we just talked about to help federal workers will have a general fund impact. All of this is going to incur in the context of additional mandatory spending required for K through 12 education and Medicaid, which is estimated to cost at a minimum $1.75 billion in the next biennial budget. This and SNAP mandatory spending alone will require over $2 billion in the state's next budget. The governor left an unappropriated balance of $900 million for use in our next budget, and this will help address spending needs. We currently have a combined $4.5 billion in rainy day and revenue reserve funds. Both of these funds were created to help address revenue shortfalls, not spending pressures resulting from realignment of the federal government. Access to the rainy day fund is limited by the Constitution. Based on these rules, Virginia can access these funds until there is a 2% shortfall against an adopted revenue forecast, which will occur no earlier than the close of FY 2026. Access to the Revenue Reserve Fund is bound by the code, making those funds easier to access. All of these resources are not a solution for ongoing obligations like K through 12, Medicaid, and SNAP spending. Prudent fiscal policy aims to fund ongoing commitments with reoccurring revenue that the state can rely on in future years to cover the cost, not one-time emergency savings. To wrap up the 45 slides of information that preceded this last slide, I want to leave you with two thoughts. They'll be quick ones. We still don't know what we don't know, meaning we are going to learn more about the impact of choices already made by the federal government, or there'll be new decisions for the state to evaluate in the future. This is going to be an ongoing process that occurs over the course of years, not months. And we know more than we did in February. And with this new information, there are some actions the General Assembly can take in its next legislative session to help unemployed workers and collect the data it needs to prioritize and plan to address federal spending shortfalls. With that, Mr. Chairman, we've made it to the end of the slide deck, and we will open it up to questions with our entire staff, helping to address them based on their area expertise.
Great. Thank you very much, Kim. And I'm amazed we're able to boil down that amount of work and that amount of information even in those slides. Thank you to all of our staff for presenting today and for your expertise. I do want to mention for our audience and those online is that the presentation as well as the full report will be put online later today. And so you'll have the opportunity to look through those details as you wish. At this point, I would open up the committees to any questions they may have of our presenters. Delegate Watts.
Thank you, Mr. Chairman. If I could, I have 2 points from the tax side and then one personal note on presentation.
Delegate Watts.
And 2 points from the tax side. I do appreciate in the slides where it was mentioned that it's not just the programmatic appropriations, but it's also very much the tax revenue. And my first point would just reflect on what many of us are aware of in the recent dispute over the accuracy of the Bureau of Labor Statistics and on unemployment and jobs and so on that has been ongoing for several months now on the federal level. As I have tried to follow a wide variety of news sources as well as think tanks on this, my understanding that part of the problem is that you don't get a picture until you really know what the employer is in fact forwarding as far as his employees, and that is not an immediate picture. Very often is tied to the tax year. And I wanted to emphasize that because as I heard the presentation, the initial presentation of the 10% jobs were jobs in Virginia, while a lot of our residents who are paying individual income tax live in Virginia but work in DC. So those jobs, as far as our revenue from the individual income tax, upwards of 70% of our general fund, are potentially, I believe, going to be more impacted than what it appears, which is one of the reasons why tax department is holding back, given what I just mentioned in terms of the Bureau of Labor Statistics. You don't know this until we actually get into the tax year. So I wanted to sound that cautionary, and again, particularly because of the large number of Virginia residents who work in DC are not necessarily being reflected in the numbers. And then the second thing that on the tax side that I wanted to underscore is, having been through a few battles on conformity in the past, that while it's in the text as the first impact as far as the amount of dollar cost to Virginia if we conform with the federal tax, it's in the text that this is the business expensing. Verbally, all we heard was the individual side of it as far as overtime and the other tax changes that were made. And I just wanted to underscore that the biggest impact, in fact, is going to be the business expensing, because that will be an issue that we need to deal with. And then while I have the mic, just on a personal
Chair Watts,
note,
go ahead.
I have been following nursing homes forever. It was not mentioned in any of the presentation. My understanding is there's some specific cuts as far as the funding of nursing home, our most needy of the Medicaid, and I'm looking forward to additional information about what those proposed cuts in H.R. 1, in fact, are going to impact Virginia's nursing homes.
Very good. Thank you, Chair Watts. Delegate Thomas.
Thank you, Mr. Chairman. I do have a question for our experts. I believe it's about the $900 million that was reserved from the budget. I'm just trying to, Maureen, so my math is not great, but I was looking at the expenses that are either mandatory or at the very basis we're going to have to make sure people's health insurance doesn't go up, to make sure that children are fed. We're looking at an amount that far exceeds what was reserved in the budget in one-time funds. I'm trying to see if that can get squared away for me, if we can take a look at what was reserved preemptively in the budget, and then how much of these figures that we've just seen lined up here today exceed that.
Well, again, that's the unappropriated balance going to close out this biennium. Most of the expenditures will be in the next biennium. There will also hopefully be revenue growth. And at that point, there will also be decisions made on cuts or other actions that would be needed to balance the budget for the outgoing, the new biennium. But I mean, we can certainly put that together.
Yeah, to reiterate what Michael was saying, is that's just the unappropriated balance at the end of the year. That will get carried forward, and then you'll look at, through the fall, develop the revenue forecast. So that will become a number. Then you'll look at things like revenue surplus. Then you'll look at things like revenue growth. And that will come up with a number to know how much of that spending that we've kind of done some back of the envelope math could be addressed or accounted for in the next biennial budget. But we don't, that process kicks off in October, so we don't have the fine print quite to tell you yet. I hope that makes sense.
It does. It does. Thank you.
Okay.
And I guess, Kim, if I could, because I think what Delegate Thomas was trying to get at was kind of an order of magnitude comparison. You know, so if you're looking at 900 million and that's kind of thrown out there and it's in people's brains, it appears, and I think the report kind of highlights that the obligations that we would have if we were to just use one-time funds would probably exceed that $900 million or come close to it. Is that accurate?
I would say some of the numbers that we came up with in terms of, I cited $2 billion of potential need in the upcoming biennium. The SNAP cost share, that's going to be ongoing. The potential Medicaid reforecast as well as K through 12 rebenchmarking, that will be ongoing costs. So you have $900 million reserved. That could be used for one-time spending, but it depends on where your revenues are growing. If they're growing in stable sources and that $900 million is going to be stabilized over the revenue forecast, then you likely could address half that need with that $900 million. But again, don't have the details yet. And so I don't want to say like the $900 million will cover all one-time spending because it's a little premature to get there. I hope that makes sense.
Yes, thank you. Delegate Price.
Yes, thank you, Mr. Chair. I understand a lot of our conversation is looking forward to what the forecasts are, but I want to ask something about looking backward and wanting to see, our localities are making their budgets based off what the federal government told them they were going to receive. So I definitely understand the action of getting a more comprehensive list of what was rescinded, but wondering if there were any actions that can be taken to go after that money to recoup it from the federal level.
Mr. Chairman, Delegate Price, I will take a shot at a response to that. I'm not a lawyer, so I don't know what legal remedies there are potentially for localities to kind of go after canceled or rescinded funding. That would be a matter for kind of a council to kind of advise us on that. But I do think one of the things I'll leave you with is it's been a matter of uncertainty. Like Zach addressed in his comments that K through 12 has kind of been a bouncing ball, for lack of a better term. You know, earlier this summer, we thought we were going to lose $123 million of K through 12 spending. Well, that changed. We have that money right now. And so I think the big concern for local government budgets is the money going to be there in the future? Is it going to be a source of money that we can count on? But I am really not sure if they can sue the federal government to recoup that money.
Delegate Price, does that answer your question? Yes, thank you. All right. Do we have additional questions from the committee? Delegate Sickles.
Chairman, I have a couple comments and a question about Medicaid. The comment on SNAP is that the Joint Oversight HHR subcommittee with the Senate had a hearing on this yesterday and heard about the administration's plan to get us down under 6% error rate. And I had previously, in my role as chairman of the Health and Human Services Committee, asked the commissioner, what is the plan? He sent me a letter. If anybody would like to see, I'm optimistic that we can do this. The big challenge is, as was mentioned, is that we have 120 local departments of social services that implement this, where any errors are made there. It's not a direct state program, but we have $270 million riding on these local agencies doing a little bit better job. And I think we can do this. Second thing is, it's depressing to me that we are losing the subsidies on the individual exchange. People may or may not know, if you have less than 50 employees under federal law, you don't have to have any benefits, employee benefits or health insurance. And so the individual market is intended for people who don't have employer-sponsored benefits. It's been very successful. We transitioned away from healthcare.gov to our own exchange a couple years ago. It was done smoothly, one of the greatest achievements that it didn't make much in the newspaper. Great success story. We have, I think, about 120,000 people in Virginia that buy their insurance on the exchange. Most of those are getting a discount on that insurance. What we've achieved is the lowest uninsured rate in Virginia history. We're tossing that out the window. People are trying to guess who will leave when the premiums go up. That the rates have already been announced, and there's various estimates on how many people leave. The people who are most likely to leave are people who think they're healthy and don't need health insurance. And that means that the people remaining are the sicker people. Anyone who has a chronic health condition is not going to, if their premiums go up, they're still going to make those payments because they need it. That's called adverse selection. That means that premiums are going to go up for the people left in the exchange. So there are a few people in Congress that are saying they're going to revisit this. We've got until December for them before they officially run out these advanced premium tax credits. So let's all cheer for Congress. Maybe they'll do the right thing and not hurt our this big part of getting our uninsured rate down. My Medicaid question is, these administrative costs for able-bodied people be required to work. If we, who is going to implement that? How much is that going to cost? And what is the role our managed care organizations are going to play in that? 95% or so of our Medicaid programs administered by private companies. There's 5 of them. And what role will they play in making sure people are trying to work? And if you're an able-bodied person, determined that you're able-bodied, and you stop working because you're healthy, what happens when you have a stroke, have a heart attack, or get in an automobile accident and show up in our emergency department and you're Medicaid eligible income-wise? Can we put them back on Medicaid at that point? Or is it going to be charity care and increasing our cross subsidies that characterize our healthcare system? So, Susan, how about that?
There's a lot you've packed into that question. I think some of it's rhetorical, but if somebody does not have insurance and they show up at the emergency room and they have a life-threatening emergency, the hospital under EMTALA will have to serve that individual. The hospital will do a screening for Medicaid eligibility, and if they fit the requirements for Medicaid eligibility, they can be enrolled. At the very least, many of those people could be eligible for what we call emergency medical services or Medicaid services, but that group of people that could be required, that currently is served, is going to narrow based on their immigration status.
So your answer is this will not be a charity care situation for our hospitals. They'll be able to.
For a portion of the people that show up. For some people that don't qualify for Medicaid, they may have to pay privately. To what extent that they're able to pay their bills is another question.
Chairman, on the other part.
Delegate Sickles.
On the other part of the question, implementing the oversight to making sure that able-bodied people, whoever that is, without children and all the other factors that narrow it, are working, trying to get it. I mean, who's going to do that?
Eligibility is done by your local social service departments. So they will need the electronic tools to be able to do the eligibility every 6 months, and somebody will need to be responsible, and it could be theoretically a contractor that the Department of Medical Assistance and DSS together work on to track. How do you track whether they've got their community service work or education, and that's a question. We don't know yet. There are some private firms out there that can assist with that. That'll have to get worked through.
Thank you, Mr. Chairman.
Thank you. And just so everybody knows is that my request to speak screen isn't picking up correctly. And so we're going to do this the old-fashioned way, which is if you have questions, please raise your hands. But the ones who were insightful enough to text me first are in the queue. Delegate Simon.
Thank you, Mr. Chairman. I want to revisit again, and I know I don't want to belabor the point too much, but the question about the access to the rainy day fund, right? I mean, we've heard, I think someone's got a letter from the governor on our emails, that things are good, right? We're running budget surpluses, we've got money in rainy day funds and so on and so forth. And I guess the analogy that I might use is, we just saw a sign on the highway that says there's an accident ahead, right? But we look down at our speedometer and we're still running 70 miles per hour, so we feel like everything's fine. But feels to me like what we want to do here is maybe turn on our GPS and see if we can explore some alternative routes to see how bad it's going to get. But the point being, we've got all this money, things seem to be going well, but the rainy day fund means something unexpected has to happen as opposed to something expected, right? So we've turned on the GPS, we've seen the sign that says there's an accident ahead. We have an obligation, as I understand it, I am a lawyer, but not a budget person, to try and forecast for those things. And then if something we didn't see coming happens, then we can access those rainy day funds and those surplus funds. Am I understanding the basics correctly? Am I missing? Is that too simple an analogy?
That is correct. And it's important to note there's two funds. One is the Revenue Reserve Fund. One is the Revenue Stabilization Fund. The Revenue Stabilization Fund is in the Constitution, and it's the one that you cannot access unless the 2% shortfall occurs, and there's no way around that. The whole reason we created the second fund, the Revenue Reserve Fund, is it's much more flexible. So you view it as one is basically a structured long-term fund that is only there in case of pure emergency. The other one you do have some more flexibility with. So it's two different funds, and one is much more flexible than the other.
All right. And Mr. Chairman, follow-up question?
Delegate Simon.
And so those funds are there, but they're sort of an accumulation of things that have accumulated over time. And so once we spend that down it's not available for ongoing uses. So we'd want to be typically careful with something like that to spend it on what we would expect to be one-time expenses and not to backfill lost revenue that's not going to recur year after year. Is that?
That is correct.
Okay. Thank you, Mr. Chairman.
Very good. Thank you, Delegate Simon, and thank you for that GPS analogy. That was brilliant. And I think it is important, if you know that the impacts are going to happen and you can adequately forecast those in the revenue, you can't access those two funds. It has to be something that's unanticipated, that isn't included in the revenue forecast. Delegate Reed.
Yes, thank you, Mr. Chair, and thank you for the kind of the heads up about texting, so I appreciate that. But I have a question, and I'm now not sure whether or not I should direct it towards Kim or towards Delegate Sickles, but I'll just start with directing it maybe towards Kim. We had gotten the input from Susan that the Medicaid requirements was going to require significant IT improvements, and then you identified that kind of a range of that would be $500 to $250 million based upon what other states had done. And what I'm curious about is with the SNAP error rate, because of the way that we do this, how do we get it from 15% down to 6%? And what's the projected cost that we're going to have to incur for that? Because while we're doing it at the local level, I imagine that they probably don't have the resources to be able to get to that level. And at what point getting from 15 to 10, is that easy? And then getting from 10 to 6, do the costs go up tremendously?
Yes, Delegate Reed. Mr. Chairman, I'll start off with saying the numbers I cited from other states in terms of those IT costs were only for states that had implemented Medicaid work requirements before. There was a GAO report that came out that had some of those costs. So I threw them out there as a range to give you some information and perspective that it could range from as little as $5 million to $220 million. It could be more, could be less. We don't know, and that's the point. And then for your SNAP question, I'm going to have Amy address that.
So Delegate Reed, unfortunately, there's not a good answer of how we're going to lower our error rate. It's not going to be easy. For the past probably decade, it's been around 9.1, 9.5%, and that's not for lack of trying. DSS has started a bunch of new initiatives with the executive order that the governor released earlier this month. They are looking into hiring a contractor to do a root cause analysis to try to, narrow down what some of these problems are. They have started initiating new training for the local departments. As Delegate Sickles mentioned earlier, we have 120 local departments, and they are the ones that are really looking at these cases, and that's mainly where the errors are occurring. So we are trying to get more training for the localities. DSS is also applying for a couple of waivers to try to get our error rate down. So one of the biggest cause of the error is that it's coming from self-reporting from the individual applying for the benefits. So they may go into their local office and say, my income is X amount. However, something could change in the coming weeks or months. Maybe they've gotten a raise at their job, or maybe they've picked up a second job like with Uber or delivery services, which would increase their income. If that case gets pulled from the quality control office, that is automatically flagged as an error because their income has gone up, but it's no fault to anyone since they've reported their income correctly at the time, but it has gone up naturally. So that's one of the examples that DSS is trying to get a waiver for, of saying, hey, please don't count this as our error rate because this error didn't occur at the time of eligibility. So there are some initiatives happening. I think maybe we can get it down below 10%, maybe. I've never been a very optimistic person, but it's possible, but it is not going to be easy.
Very good, thank you. Delegate Austin, then Delegates Fagans and Lopez.
Thank you, Mr. Chairman. Mr. Chairman, my question will be for Kim. Kim, if I'm correct, I think I heard you say that we would reach a revenue shortfall by year end. Is that? So we're continuing to meet our revenue forecast and exceeding it by the 2%, which would limit our ability to access about $2.9 billion of the rainy day fund.
Yes, Mr. Chairman, Delegate Austin, I believe that's probably an accurate statement.
Yeah, I think we have about 4.5.
Mm-hmm.
So.
We're continuing to meet all expectations in terms of growing against the forecast. Things look optimistic, and so when you have rules that say it has to be a 2% shortfall against an adopted budget.
Correct. So that would leave what I call the super fund, what we used to call the super fund, about $1.6 billion that could be accessed.
Yes, because it is in the code, and we can always change the code to access funds.
Yes. Now, having said that, I'd like to speak to
Delegate Austin.
Thank you, Mr. Chairman. And I know I'm preaching to the choir here on appropriations. The chairman and I feel the same way. We have to all be very guarded and be very careful how we go and intend to use those revenues for reoccurring expenditures. That's been a policy of the appropriations for many years. And I know we're not going to be able to meet all of our demands, and I think we all have to acknowledge and be very guarded and very careful in how we go about approaching that, and I know we will. We take our responsibilities very seriously on appropriations. This is a serious matter. There's a lot of serious things here that impact the Commonwealth of Virginia in significant ways. So I just want to emphasize that we are limited at what revenues we have and what revenues we can access, and I think we'll exercise that caution at the appropriate time. Thank you, Kim. Thank you, Mr. Chairman.
Thank you, Delegate Austin. Delegate Fagans.
Thank you, Mr. Chairman. This question was for some of the housing stability ideas that were presented. So I'm familiar with the Service Members Civil Relief Act, and not a lot of my airmen utilize that to make sure that they were able to break their lease during TDYs or deployments or PCSs. When we're looking at it at the state level, I had two questions. One, was there a projected cost on that? And the second question was, were we looking at it strictly from a federal contractors, or were we looking at it from federal contractors, NAF employees, contractors that were working for federal contracts, or strictly from a GS employees?
Mr. Chairman, Delegate Fagans, that's a great question. Generally, any changes to the Virginia Landlord-Tenant Act do not have a cost associated with them. There may be like one or two bills I see that have a cost, and it's usually directing DHCD to do something so likely any changes to that act allowing federal workers to end their leases early would have no cost to the state budget. The second answer to your question is that I think those are some of the policy choices that you could consider if you want to extend limit the provision to just GS employees, federal civilian employees, or expand it to those impacted by shifts in federal contract spending. So I think that's up to the General Assembly to determine if it's an idea that they want to move forward and how narrow or broad they want it to be.
Thank you.
All right, thank you. All right, so I've got Delegate Hodges, then Delegate Lopez, Delegate Bloxham. Anybody else before we wrap this up? Okay, let's go ahead and cap it there. So Delegate Hodges.
Thank you, Mr. Chairman. And first, thank you all for being here today and with the presentation. I guess my question is, how much is the sky actually falling? And, how was this, what we were presented today, when numbers were used, and was it really based on worst case scenario? Because in looking at this, we were projected at losing 32,000 jobs. Virginia's been roughly a third of that. And Virginia economy is actually, through all of this, has still remained strong. And with our revenues at a $1.7 billion surplus, and we were projected losing, I think it was like $250 million over this. So, we have a lot of unknowns still. And how do we base these reports? And moving forward, and has the report actually, what numbers are actually used? And was it worst case scenario?
Mr. Chairman and Delegate Hodges, I think the report and kind of the numbers we used are trying to ground people in that, we've said that things still look good from a revenues collection standpoint. We're still moving forward. I cited that jobs were added to Virginia's economy, but at the same time, when you look down at the industry level, there are also jobs being shed. And what particularly concerns me is it's in the professional, technical, and sciences industry, which is kind of one of our strongest industries in the Commonwealth. And so those are highly paid employees, which contribute to state tax revenues through personal income tax. So the overall job numbers are growing, and we're projecting out. But at the same time, those overall gains are masking losses in core industries for the Commonwealth where we pick up money and are able to spend it through the state budget. And so that's concerning to me. So the numbers that we provided are based on what we know now, but none of us can predict the future or what's going to happen. So we tried to provide a balanced approach and try to give people some numbers to start to react to and think about and refine as we move forward.
All right, thank you. Delegate Wilt.
Thank you, Mr. Chairman. I think my question is for Zach. You reported that and I can't remember, it was way back in the slides there, but about the grants, that the $2.5 billion in grants were frozen. So you'll have to refresh
the education grants in particular. Yes, back in July, that was when the administration froze. It was a higher number than that nationwide. It was, I want to say it was $6 billion that was frozen, impacting about $120 million in Virginia.
Mr. Chairman.
Delegate Wilt.
So since that time, has the state of Virginia been able to recapture those grants?
Yes, all of the funds that were frozen for
all of the funds.
All of them were released.
Thank you, Mr. Chairman.
All right, thank you. All right, and because I saw a couple other people, I just have two, so we're going to do Delegate London King, and then we'll end up with Delegate Lopez.
Thank you so much, Mr. Chair. So I represent Stafford County, and I was recently apprised that the potential SNAP changes will cost Stafford alone over $1 million a year, and 20,000 people are facing losing their health care in Stafford alone. So I would posit that the sky is actually falling for those families who are facing these devastating cuts. But my question I heard a little earlier is about education, and just want to make sure I got numbers right, is that the Title I schools are looking at up to 30% cuts? Was that correct?
Those, in the House of Representatives proposed budget, that is the cut.
Okay.
Yes.
And what would that look like on the ground level for localities?
As far as a percentage basis of
Right,
the.
like what would be impacted? Would it be teachers, support to students? Like how would that impact those schools?
Generally, the way these funds are distributed, they're distributed, higher need schools are receiving more of those funds, so you would see a pullback of funds for schools with higher poverty rates that fit into the Title I category. But as far as what the funds are used for, they're fairly flexible, but they are targeted towards that population.
Okay, thank you. And then just a quick
Yep,
follow-up.
Delegate Munden King.
So this was not for you, but thank you so much for that information. A quick follow-up is within the higher education portion, I saw some information regarding an earnings test that higher education institutions could lose access to certain federal funding if they don't show a particular earning after a few years.
The way it would work is, I believe it's 4 years after you complete, they're going to compare those individuals and the median earnings of those individuals compared to a working adult that does not have that degree. So, for example, if it's a bachelor's degree that you get, they would compare it to maybe a working adult that is just a high school graduate. If it's a graduate degree, they would compare it to a working adult with a bachelor's. And if those earnings are not greater for the person with the degree than the person without the degree, then those programs, the programs themselves, would be at risk.
Got it, thank you. And so there is a recurring theme here. Thank you so much. There's a recurring theme here. This ugly bill, these ugly actions are putting 300,000 Black women out of work. Our historically Black colleges and universities will potentially lose funding because although Black women's equal pay day just passed and we already earn less than everyone else in the economy, our universities would then be put to an earnings test to pass to keep certain funding. So for those who need health care, the sky is falling. For Black Virginians whose universities are being attacked, whose earnings are being attacked, the sky is indeed falling. Thank you, Mr. Chair.
All right, thank you, Delegate Munden King. And so last is Delegate Lopez, and then we will have Chairman Torian wrap it up.
Thank you, Mr. Chairman. Just two questions. But first off, let me just say I don't envy the staff that's been working on this because this is an incredibly opaque process at the federal level. They're not defining terms. They're not defining how a program is going to be applied. It makes it nearly impossible for states to actually address their planning needs. And if I don't envy you guys, I definitely don't envy localities who are trying to budget based on I believe, fundamentally broken process at the federal level where rescission is now common and where pocket rescissions without the even buy-in of Congress by the administration is becoming a threat. So I know that the labor figures are not set yet, and I know that they're several months behind. But in the presentation about grant cancellations, rescissions, and eliminations, you talked about nearly $1 billion, just in the three you chose, nearly $1 billion of cuts for our ports, for the port infrastructure security grants, and then for BRIC, for all the resiliency efforts we're doing. Can one of the folks from the committee staff tell me how many jobs that is? Because these are real people we're talking about at the end of the day.
Yes, Mr. Chairman, Delegate Lopez, I'd love to tell you how many jobs are connected to each of those grants, but we don't have that information. The best we can give was what we uncovered with our work with the Weldon Cooper Center for Public Service, which revealed about kind of how federal grant spending supports local government employees, and it's about 3,500 in the Commonwealth.
Thank you.
Delegate Lopez.
Just to follow up, Mr. Chairman, I think it's going to be considerably more over time than just that 3,500. And I think anyone with an economics PhD can probably back that up. The second question I have is much more focused on the farm community in Virginia and the fact that because of the subsidies, because of the tariffs, because of the fact that the Farm Bill, which we didn't talk about, which is, has to be reauthorized at the federal level, has not been reauthorized yet. You've got programs that are beginning to expire as of September 30th. Can one of the folks on staff give us a quick update on what this means in terms of jobs, in terms of lost revenue, and in terms of crops that are currently not getting from farms to market?
Yes, Delegate Lopez. I will have to admit that at this point we don't have any focused analytical work specifically around the expiration or potential expiration of these programs. We do know that the agricultural community within Virginia is the single largest employment sector within the state, and is really the backbone of billions of dollars of economic activity and exports within the state. There have been early indications from the industry that farmers in Virginia are beginning to see the impacts of some of the tariffs. However, it will take time for the actual impacts in these areas to sort of shake out. Again, you can see it coming, but it's hard to put numbers around it. I can certainly, after this meeting, reach out to the Farm Bureau and the agribusiness community to see if they have some additional information that can help guide this discussion going forward. But as of right now, we're still waiting for the picture to clarify.
Thank you, Mr. Chairman.
Right. Delegate Lopez.
Yeah, I would just say that I go back to my very first comment that this whole opaque process that is making it nearly impossible for states and localities to do the basic budgeting we need to do is mind-numbing. But at the same time, you've got generational farms, you've got elderly folks who want to make sure that they have their ACA premium tax credits taken care of, you've got health care issues, you've got jobs. And the fact that you admit that this is an opaque process and you don't have the information yet about how many jobs this is actually really affecting and how many lives this is really going to be affecting. But if you take the macro out, the decisions that were made in Congress, it's horrific about what it's going to mean for the Commonwealth and what it's going to mean for localities and what it's going to mean for real people. So thanks for your input. Thank you.
Great. Thank you, Delegate Lopez and Chairman Torian. You've got the last word.
Good afternoon. Good morning to everyone. Chairman Bolivar, thank you so very much, and to your committee, thank you for the work that you've done. To House Appropriations staff, thank you all for the work that you've done. Our gathering today was to receive the report from the Emergency Committee on the impacts of federal workforce and funding reduction, which suggests to me that we can anticipate that there are going to be some changes. We can tout how strong our economy is right now in the Commonwealth, and it is in a good position. But I want to alert my colleagues that we have been forewarned this morning that there are going to be some changes and that there are going to be some challenges that we will have to face. And we will do that. We will not run to our reserve funds. So for those of you who think we're going to run to the reserve funds, do not allow that to be a thought in your mind. When it is critical for us to go in that direction, then we will. But we will work hard to appropriate the resources where they are needed to meet the basic fundamental needs of the citizens of the Commonwealth. That would be health care, education, increasing our job workforce as much as we possibly can, protecting those vital interests that we share here in the Commonwealth. And then lastly, Mr. Chairman, I want to alert my colleagues in this manner. You have received this report, so be mindful of this report and be mindful of the expectations that you may bring to Richmond come January 2026. Thank you, Mr. Chairman.
All right. Thank you, Chairman Torian. But I think that is extraordinarily well said. I think Vice Chair of Appropriations, Delegate Austin, also echoed the issue, which is that we have some serious, this is serious, and we've got some serious issues that we need to work through, both ahead of the General Assembly session and during the General Assembly session. And that's going to require all of us working together. Let me just close up by saying I want to thank the Speaker for his faith and confidence in the Emergency Committee. I also want to thank my fellow committee members who gave hours of their time away from their families and their jobs, going that extra mile to listen and provide constructive input. I want to thank the clerk's staff, particularly Kathy Ho, for their excellent work with the logistics and technology. I also want to recognize all of our appropriations staff who did a great job throughout this process, but I do want to particularly recognize Kim McKay and David Reynolds. I think we met every week between February and this last couple of weeks, and so thank you very much. You've been outstanding partners in this process. Finally, I want to thank everybody who presented, participated, and submitted comments throughout this process. Your input and expertise has been invaluable. I've just been informed that the electronic report is now up online, and seeing no additional business, the committee shall rise. Thank you.